Hello students, my name is Rajgun Hendik, Assistant Professor, Social Work Program, Department of Humanities and Social Sciences, Assam Downtown University, Guwahati. Today in this PPT, we will be discussing about the concept of contraception and also about the different methods of contraception. Meaning of contraception. Contraception means preventing the union of egg and ovum, suppressing ovulation, and interfering with the implantation of the fertilized egg in the uterus. In simpler terms, contraception means preventing pregnancy. Contraceptive methods. The available contraceptive methods are generally divided into two categories: spacing method and terminal method. Spacing methods are generally used for birth spacing. Birth spacing is the practice of waiting between pregnancy, whereas the terminal methods are permanent contraception methods of sterilization that prevents pregnancy permanently. Some of the available spacing methods are: for men, condom; for women, intrauterine devices like copper T, oral pill, diaphragm, and injectables; and for terminal methods are vasectomy is available for men, and for women, tubal ligation. Male condom. It is a form of contraception for men. It also protects against sexually transmitted infections, including HIV, which leads to AIDS. It is used as a barrier to stop sperm and infection passing between sexual partners. It is usually made of rubber. Condoms are generally easy to get, easy to use, and have no side effects, unless a person is allergic to rubber. Intrauterine devices. It is a long-term birth control method of contraception for women. It is a small device that is inserted into a woman's uterus to prevent pregnancy. They are cheap and one-time method. It requires no attention after insertion. It can also be removed when pregnancy is desired. It is not a hormonal method, so it has no side effects on the rest of the body. However, some women face abdominal pain. Oral pill. It contains estrogen and progesterone hormones. These hormones stop the egg development, so there is no egg release from the ovary. It also reduces the risk of ovary and endometrium cancer. It also improves acne. Some of the disadvantages of oral pill are that it may cause dark patches on the face and also increase the risk of heart attack for smokers. Emergency contraceptive pill. It is taken after unprotected sex to prevent pregnancy. This pill is approved to be taken up to 72 hours. However, a few women have side effects like vomiting or feeling unwell. Therefore, it is advisable to take the pill with food to lessen the side effects. Diaphragm. It is a female condom where it covers the cervix completely and prevents the sperm from entering the uterus. It must remain in place for at least 6 hours after intercourse. To increase its effectiveness, a contraceptive jelly or a cream should be used with the diaphragm. Advantages: it is cheap and does not interfere with sexual intercourse. Its disadvantages are: it is difficult to educate the illiterate woman to use the diaphragm. A doctor or nurse is required to determine the proper size and fit it initially. It is not quite suitable if the vaginal muscles do not have enough tone. After use, it must be washed, dried, and stored carefully in between uses. Injectable contraceptives. There are two types of injectable contraceptives currently available. One is Depo-Provera and the other is NAT-EN. Both these two injectable contraceptives contains progesterone. Depo-Provera has been much more widely used than NAT-EN. Both these are intramuscular injection. These are the most effective reversible method of contraception currently available. Some of the disadvantages of these contraceptives are that these methods have side effects like irregular bleeding and amenorrhea. Tubal ligation or tubectomy. Tubectomy is a surgical procedure for sterilization in which a woman's fallopian tubes are cut. When a woman is sterilized, the operation is called tubal ligation. Vasectomy. When a man is sterilized, the operation is called the vasectomy. The tubes are cut and tied during vasectomy. It is a simple, safe, and a minor operative procedure that can be performed under local anesthesia in primary health center. It is a permanent method of family planning for those who want no more children. In conclusion, I would like to say that India was the first country that launched family planning in 1951. Despite the fact that India is the second most populous country in the world, it is because people neglect to use contraceptive methods. So, thank you.